Goni cervical extension. Position the patient in sitting with the thoracic and lumbar spine well supported by the back of a chair. Position the cervical spine on 0 degrees of rotation and lateral flexion. If necessary, the patient can hold a tongue depressor between the teeth for reference. In patient-appropriate language, ask the patient to extend the neck. Assess the trunk for extension of the thoracic and lumbar spine. Usually, stabilization is achieved through patient cooperation and support from the back of the chair. Put one hand on the back of the subject's head and with the other hand hold the subject's chin. Push gently but firmly upward and posteriorly on the chin to move the head through range of motion in extension. Observe the trunk to prevent extension of the thoracic and lumbar spine. The end of cervical extension range of motion occurs when resistance is felt and additional motion causes the trunk to extend. Assess the end feel, which is firm because of passive tension of the anterior longitudinal ligament, anterior fibers of the annulus fibrosus and the facet joint capsules, also because of the sternocleidomastoid, longus capitis, longus coli, rectus capitis anterior, and scalenus anterior muscles. Extremes of extension may be limited by contact between the spinous processes. You're now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. Align the axis of the goniometer over the external auditory meatus. Align the stationary arm so that it is either perpendicular or parallel to the ground. Align the movable arm with the base of the nares. If a tongue depressor is used, align the arm parallel to the longitudinal axis of the tongue depressor. Ask the patient to perform cervical extension as done previously, maintaining the goniometer in alignment through the entire range of motion and observe for any extraneous movements of the trunk. Read the degrees of motion on the goniometer and then ask the patient to return the head to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document it in the patient's chart. Average range of motion according to the American Association of Orthopedic Surgeons is 45 degrees.